everyone. My name is Sean, and I'm a member of the GCC Diversity Committee, who is proud to welcome Dr. Lopez to the virtual campus of the college for today's talk, Combating COVID Amongst the Latinx Community Through Data, Art, and Tailored Communication. Dr. Lopez is a broadly trained social scientist with experience in mixed methods of research. He is particularly interested in identifying and addressing structural and cultural factors that pattern the unequal distribution of disease and racialized minority and rural populations. Recently, he has done this by creating culturally tailored and empirically based health communication campaigns focused on bringing needed COVID-19 information to Latinx across the U.S. Southwest. And something interesting I learned is before getting his master's at Johns Hopkins and his doctorate from Harvard, Dr. Lopez actually started out at a community college. So we're delighted to welcome him back to our college now. And all right, so I'm going to go ahead and turn it over to Dr. Lopez now. But we should have some time at the end of his presentation for questions. So please put whatever questions you might have in either the chat or the Q&A sections to the right, and we'll try to answer what we can towards the end. All right, so the floor is yours, Dr. Lopez.
Thank you, Sean. Hi, everybody. I'm excited to be here. Let me just share my screen. So yeah, my name is Gilberto Lopez. I'm a professor here at Arizona State University School of Transborder Studies. And my work, like Sean said, looks at various different aspects of health, especially the social determinants of health, how the context of where people live, where they work, and where they play affects people's health. Today, I want to talk a little bit about the project that we've launched a few months ago, looking at how do we bring culturally tailored health communication, COVID-19 information to the Latinx communities across Arizona. And that was the focus of the project. So I'll talk a little bit about that. Overview of what the talk will entail today. I'll start by giving context of COVID-19 disparities and inequities and why it matters that we pay attention to the unequal distribution of this disease in the last year and a half, 2 years, going on 2 years already. Then I'll talk a little bit about the CASA COVID studies. It's the data that we collected. So we started with a problem, we collected data to better understand it. And then I'll end with the COVIDLatino.org campaign, which is informed by the data that we collected. And the COVIDLatino.org it combines the arts, the social sciences, the health sciences to create culturally tailored health communication information or messaging for Latinx communities. Feel free, I'll stop at each one of these where you see these arrows. I'll do a stop for a few questions. So if you have questions on these sections, I'll stop then, and if you could ask a few questions. But we'll also reserve the end after the talk for more questions. So COVID-19 disparities, just to put this in context of the magnitude of this is just here in the US. These numbers have changed since this report came out, I think September 15th. So putting it in context with how much death we've had because of this pandemic. Some estimates have it at, in this case, was over 660,000. We surpassed that. We surpassed the Spanish flu. But in the history of the wars and the pandemics we've had in the US, which are the events that take the most lives, for a single event, we are now number one, or COVID now is number one of all time. And this surpasses the Spanish flu, World War II, World War I. And I think if latest numbers, if you combine all the world wars and the Vietnam War, I think COVID still has more deaths. We have more deaths because of COVID because of that compared to these wars. And I say this just to give you an idea of the magnitude of how impactful this has been to our society. And I'll talk in a minute how this impact is not seen equally across our populations. There's some groups that are affected more than others. Another thing to keep in mind here is the time period. These world wars were 4 or 5 years long. COVID, it's going on year 2, and this is how many deaths we've had in a very short period of time, almost at par with the Spanish flu at the rate of how fast it is causing death in our society. And predictions show that it's here. It's going to be here a while. It's going to be a while before we're out of this pandemic. So, and again, this is just to give some context of this magnitude and how big of a deal, how big of an issue this is in our society. And you know, a report came out in February, data of the February. Again, since then it's close to 700 now, but we had 660, about 660 excess death. That is more death than expected in the in this time period. Out of those, as of February, 500,000 were due to COVID. Again, that has changed. It's now upwards of 660. But when this data came out as this report in February. So that means in this year, 500 people have died of COVID, 660 more deaths than we expected in general in our society. We know that these deaths are distributed unequally. The Hispanic and Latinx community had an excess of 50% more death than expected overall in this year, followed by Asian and Black communities at 36 and 34%. That is just the number of deaths, not necessarily related to COVID. That's how much more death we had than normal. And then we know within the Latinx community, it depends, it depends where you're coming from, the context of what type of immigrant, what type of Latinx community you're from. It also somewhat dictates the rate and the risk of excess death in this case. So we know that those who were born in Central America, who are in the US, we had almost a 50% more death than expected for this year. Mexican born were at 44%, and the US born Latinos or Latinx were at 19% above the normal. Overall, we have more death than expected, but it is different for different groups. And we're talking about COVID-19 specifically, the morbidity and mortality. Morbidity is sickness, mortality is death. We know that with regards to morbidity, Black and Latinx populations were at 3 times the risk of infections. And there was an increase in emergency department visits during the last year in 2020 and 2021. So Black and Latinx were more affected by COVID. They're higher risk of infection, were more likely to go to the ERs. And we know within certain age groups, age 40 to 59-year-olds, the Latinx community was 5 times, had 5 times the infection rate compared to other populations, the overall US populations. When it comes to death, COVID-19 related death, we see again these inequities, these disparities. We know that the Black and African American community was the most impacted by death by COVID when this data came out, with 106 people for every 100,000, with the Latinx community at 70 and the American Indian, Alaskan Native at almost 70%, 70 per 100,000. And the other statistic here is that 25%, 1/4 of death in the Latinx community was among those under 60 years old, younger than 60 years of age, compared to 6% among whites. So we have 25% of Latino death under the age of 60, and 6% of death in whites is under the age of 60. So we see this huge disparity of who is being at risk of infection, who's getting infected at higher rates, and also who's dying at higher rates because of COVID. So the question is why? Why is it that certain groups are disproportionately affected? And we also have here kind of the impact that this is having on overall life expectancy in the US. Across the board, life expectancy has dropped 1.5 years in the US in general. So that means that before COVID, I don't know the exact number, I believe it was around 70 years of age. That's how long the life expectancy, maybe 75 in the US. 75 years of age was the life expectancy for the average American. That dropped because of COVID. It dropped by 1.5 years. However, this drop is not equal across populations. We know for the Hispanic or Latino men specifically, there is almost 4 years of age less. So again, if the average life expectancy before COVID for Latino men was 75 years of age, that dropped. Now it's close to 71 years of age. So that's a 4 year difference. And they're different for different populations. We see here this bar graph that's here, that Hispanic men have the lowest, again, 3.7. We also have Black men as well. Hispanic men, Black men were the most affected and have the most years of life lost because of this pandemic. And again, so the question is why? Why is this happening? One framework that we use is this idea of the social determinants of health. The context, where you live, where you play, and where you work matter for your health and dictates your risk of certain health outcomes and certain health behaviors. With regards to COVID, we know that Latinx community, these issues come up. Healthcare access and utilization, immigration status, the fear of using any kind of public service because it will affect your migration status, whether you're waiting for the judge to go to court to hear your immigration case. This idea of public charge, you're a charge on society, you're taking resources from the U.S. government, and that's going to negatively affect your status. Whether or not that is true, and we saw that through the pandemic, a lot of these policies were a lot more lenient, where they allowed almost anybody to come in, get services free of charge, and many times without asking for ID or any identifiable information. However, the fear of it, of this might affect me down the road, prevented a lot of in our immigrant communities, the Latinx communities, from seeking services. The other issue is insurance. You know, what type of health insurance, if any, does the people in the Latinx community have? They have the lowest prevalence rate of health insurance compared to other ethnic minority groups in the U.S. And that also prevented a lot of folks from seeking services for COVID. Again, a lot of these services were free of charge, the testing and the vaccinations, but that knowledge was not there. And this comes to a third point here: knowledge of services and programs. What is available? Is it free? Do I need insurance? Do I need to have my papers? Do I need to be a citizen? Can I be a resident? These questions, this uncertainty and lack of answers to these questions were factors in the low vaccination and the low testing rates that we see across Arizona and across the Southwest. The other one here of why this pandemic is disproportionately affecting the Latinx community and also other racialized minority populations, occupation. This is kind of one of the places where the infection is transmitted, where the virus is transmitted, is job sites. And we saw this throughout the pandemic. You had the slaughterhouses in the Midwest that were shut down because of the spread of the pandemic. We see it as well in agricultural regions in California, that this affected whole crews. So occupation is a very important determinant of disease in this case. We know the Latinx community is more likely to work in these jobs that we call essential jobs compared to whites. You know, we have 43% versus 25%. These are jobs that have limited protections, and jobs that you cannot work from home. These are not office jobs that you could do from anywhere. You have to be physically there, whether it's the hotel industry, construction industry, agriculture. One thing that we should acknowledge more is that even though this pandemic hit our economy and hit our society pretty bad, we were still able to have a lot of these supply routes for food available. And who was it doing these jobs? Who is it that's getting our foods? A lot of it is the Latinx community, immigrant community is 90-something% of the agricultural workforce. So in those type of jobs, you don't have those protections. You have limited PPE, no time off. You can't work from home. So occupation is another driver of why these differences exist, because certain groups are clustered in certain types of occupation that puts them at higher risk compared to other jobs and other populations. And then the third one here is housing. Housing is another factor in the spread of the disproportionate spread of COVID. One is neighborhoods with higher rates of poverty, where racialized minorities tend to live because of the type of jobs they have and the type of wages they're earning limits where they could live. So if you have neighborhoods that are, whether it's apartments or housing that's more dilapidated, it's older, and also crowded, more crowded, and you have multi-generational homes. That means that you have grandma, the parents, and the kids all living under one roof, and this makes it impossible to socially distance. In addition, you add to this where people work. People cannot take time off. You're living in a crowded space. You have, it's not uncommon to see, 7 people in a 3-bedroom house, or 2 families in a small, 2-bedroom apartment. So this, in addition to the fact that you have to work in certain jobs that put at higher risk, makes this uh, the context of where you're living super important in the spread of disease. So it puts them at higher risk. So housing is important. It's essential to understand housing and the context of housing and how that relates to occupation, to understand how this virus is spreading throughout the communities. And then you have the social cultural issues here. You got language barriers. You have the racialization and marginalization of immigrants and indigenous peoples, especially indigenous immigrants coming in from Latin America. Language barrier is that a lot of the information that we had was not culturally tailored in a way that was understandable by farm working immigrants who tend to have on average an educational level of middle school, fifth or sixth grade. A lot of this messaging was at a higher. It was designed for high school age understanding. So that was the barrier there. Language. A lot of the time, a lot of the information that was coming in, a lot of the infographics that were coming in were essentially just translated through using some software. So you didn't have that culturally tailoring of the language that is a lot easier for the community to understand. And then again, you have these other groups within the Latinx community or immigrant community. You have indigenous immigrants from Latin America, who is a growing number of them are coming to the U.S. Language is an issue. Their primary language is not Spanish. It's it's Mixteco, Zapoteco, one of the Mayan languages. And we don't have information for these populations to understand, best practices, how to social distance, where to get the vaccine, where to get tested, what's in the vaccine. All that information is disproportionately coming to some groups and not others. And the last point here of what is the driver of these inequities, and this is where we center our project, is on COVID-19 misinformation or disinformation. And the difference being misinformation is, someone got it wrong, and they put it out there. They might not have meant to get it wrong. They just misunderstood something. Disinformation is that purposely trying to confuse or deceive, somebody through messaging. Those are the difference between misinformation and disinformation. And we see that overall the Latinx community is not receiving the same quality or quantity of COVID-19 information or vaccine information throughout this pandemic. And then these studies came out recently. It was I forgot the name of the Nielsen report. Had the study that shows the Latinx community is more likely to get, to consume, and to share online misinformation and fake news. It's a very active community in social media, and a lot of the information that people are getting about COVID is coming from these social media channels. Facebook, WhatsApp, it's a really popular one. WhatsApp and Facebook are the top ones. A lot of this information is coming in, especially for the Latinx community, disproportionately affecting the Latinx community. So is there any questions? I can't see the chat, so are there any questions before I move on to how we collected the data? I'll take one question. If not, I'll continue. Okay.
One question for you. Do you know why younger folks are being more impacted, perhaps in the Latinx community than maybe other communities?
Yeah, so it has to do with working age and the type of jobs that we have. Well, that's one of the reasons. Uh, they are disproportionately working these jobs, the essential jobs, and jobs that don't have any medical leave, time off, maybe health insurance. So that's one of the reasons. And the Latinx community is just young in general compared to the overall U.S. population, just a younger population. More recently, one of the reasons, or one of the many reasons, is that we see it now affecting the younger ones in general because you have more of them. So a lot of the older folks got their vaccine. It's still not good enough, but a higher percentage got their vaccine. So there's less of them to get affected. So that's why you see it now focused on the younger population because it's just a larger population that's being affected. So those are some of the reasons. There's others, but mostly the environmental reason, where the context of where they interact socially has to do with the effects. Also, the cultural aspect of it. Younger folks, they compared to older folks, believe they're going to live forever. I'm very healthy. I don't feel sick. I have a great immune system. That idea is also preventing people from getting vaccinated, and that in turn, it's one of the reasons younger people are getting infected at a higher proportion.
Then I guess one other question in the chat. Are there specific outreach campaigns for the COVID vaccine aimed at the Latinx community? If
Yeah,
so, how are they affecting vaccine rates?
yeah. So I'll talk about that. So that's the third part of the study. That's what we get at. We're going to collect data in order to launch a campaign. So I'll talk about that, and I'll talk about what our campaign does, and I'll give some preliminary numbers on the reach we've had so far. But yeah, good question. Okay, so that's the context. That's the problem. That's the magnitude of it, and some of the reasons why it's affecting the Latinx community disproportionately more than other communities. So what we did, we launched this Casa COVID studies, and what this is, it's a mixed methods research projects, and by mixed methods, I mean that we did surveys, and then we also did one-on-one interviews, the qualitative and quantitative study. The qualitative one, we started with 60 Latinx folks across California Central Valley and across Arizona. We did one-on-one in-depth interviews. It was all done through Zoom. So we did Zoom interviews with 60 folks, and we wanted to assess the beliefs, attitudes, and behaviors around COVID. How do they understand it? Where do they believe it comes from? How is it transmitted? What does it do once it gets into your body? And how do you cure it? How do you know you're cured? Like these ideas, beliefs, and attitudes about COVID, we wanted to understand. And then we also want to understand behaviors. What are they doing? How do they protect themselves? What are the behaviors they're adopting in order to limit their exposure, if any, to COVID? And then we also did a survey. We surveyed 600 people. We did the quantitative branch of the study, and it's a longitudinal cohort design. What that means, we're following 600 folks, 600 people uh, through time. So we did wave one, which was the first survey last year. We're doing wave two currently. So we're coming back to them. So we're assessing the same things, beliefs, attitudes, and more importantly, behaviors. We want to see how people are behaving with regards to COVID. How are they protecting themselves? Are they masking? And we also want to look at different, social determinants. We want to understand, what type of employment do you have? Has there been a change in employment, in hours, in pay? Has anybody in your family gotten sick? So we want to understand that context. What type of housing they have? Do they own? Do they rent? How many people live in the house? In order to understand if there are any associations between, like we said earlier, people in more crowded housing were more likely to get COVID, and we want to see that if that's true here in our data. And then we're following them through time. We're following them for 3 years. We're currently doing year two now, and hopefully next fall we do year three. And we want to see, are there changes in this? Are there changes in hours of work, in salaries, in unemployment? And to give to give this data to see how this is impacting the Latinx community. And our focus of our study of our the quantitative the survey, we also looked at mental health, some of the psychosocial effects and the socioeconomic effects of COVID. So we're measuring depression, anxiety, and also social support networks, and trying to see if there's a correlation between that and the pandemic and these other variables that we're looking at. And we're also looking at beliefs and attitudes, and then information sources. Where are you getting your information? How do you vet the information that you're getting? So we're asking questions both in the in-depth interviews and in the survey. We ask them, where does most of your information come from? Is it coming from community leaders, from family members, from friends, from the government? So we ask these questions about information source. And I'm gonna briefly go over some of the findings that we had. We're still analyzing the first wave, but this is some of the preliminary data that we have. One of the questions we ask is, if a vaccine for COVID were available, what is the likelihood that you will get it? This was before the vaccine happened, so this was last year. So we did this analysis by language. We saw that Spanish speakers were less likely on the survey say that they're extremely likely to get it. So they're less likely to be extremely likely to get it compared to bilingual Spanish and English speakers and English only speakers. So we see language here. What language you speak kind of is associated with whether or not you're getting the vaccine. Then we looked at testing, and we asked two questions. Have you tried getting tested for the virus? Have you tried getting a COVID test? And were you able to get it? Did intent versus actually getting it? We saw that 33% of Spanish speakers said that yes, they tried to get it, compared to 43 and 53, which this is lower. But also important here is how successful they were. Of the 33%, 30% were able to get the test, compared to 89 and 50%. So there's these huge disparities of what is going on. They tried to get it, but they were not able to get it for whatever reason. And that's something we're following up on, trying to understand why is it. Again, there's something with language here. Language dictates who gets the vaccine, and I mean the test and how successful you are. And then some of the reasons, this comes out of the one-on-one interviews, for not getting tested is perceptions of low risk. I'm not at risk, I'm young, I have no symptoms, no one in my household has gotten symptoms. That is one of the top reasons people get tested. Somebody in the household, if maybe someone had a barbecue, someone came over, 2 days later they say, oh, I tested positive. Then people will get tested after the fact, after they know they came in contact with somebody. So I think I have 15 minutes. I'm gonna take questions at the end for that section. I want to move into that question that I got of what are we doing with this data? How are we using this information to give it back to the community? And that is the goal of this project. We collected the data. We're using that data to give it back. We think it's important. And the way I say it is, I prioritize the community over the academy. The academy, historically is you go out, you collect data, you publish it in a journal that no one's going to read ever, but that's how we get promotion. That's how the academy works. I don't agree with it. I think it's more important to prioritize the community and make sure that the community is getting this data back to them in a useful, and that's the goal, in a useful way. So we launched the COVIDLatino.org campaign. This is in April of this year. And this is, again, combining the arts and the social and health sciences in order to create a health communication campaign that brings needed information and resources to the community. We created infographics like the Pfizer vaccine you see there, kind of explain what's in the vaccine. We created cartoons by cartoonist Lalo Alcaraz. And then we also did a series of animations. So we started we launched officially in April by bringing Lalo Alcaraz to ASU to give a talk about cartoons. And these are some of the pieces that he did for our project. So what he did, a lot of these themes are coming in. There's the one you see on the right, the Loteria of Life. It uses the theme of Loteria, which some people say Mexican bingo. Loteria, a very popular Mexican game, uses the characters in order to say these are the things that you could win in life. This came out when a lot of the states were entering people into lotteries. You could win $1 million, you could win cars, tuition. And that was the message we're trying to get across. Like, you don't have to win $1 million. You could win all these other things by getting vaccinated. And then the one in the top left, farm workers, they were disproportionate risk of getting COVID. So we wanted to make sure that they were being heard. And this, it's cut off. The bottom left one says, don't vaccines cause infertility? And you have, again, playing on the stereotype of Latinos, having a lot of children. And she's saying, no, trust me, they don't. She's pregnant, has kids. So again, these cultural tropes that we have in the Latino community, Lalo Alcaraz was playing with. Then we create a series of animations. And these are the characters that we use. We create a whole world in which these characters live and the social interaction between characters. And we culturally tailor them. I'll show you an animation in a minute so you get an idea of what they are. So we created these animations. They're 1 or 2 minute explainer videos that we did again, to get the information out there. And then the last part here, before I show you the animations, we did infographics. So infographics, I wish I would have brought the other one. So these images, so these infographics give you information of what's in the vaccine, what is the vaccine. These were adopted from the CDC, created some like these. We culturally tailored them. Again, we use the kind of the theme of the Loteria cards for this, and we kind of adopted or modified the original version that came out of I believe it was the CDC or the NIH, and we adopted it and made it so where people could actually look at these. They're going to see it like, oh, this is, this looks familiar, so they're going to pay attention to what's in it. And that's, we work with local artists here in the Phoenix area to work on this. And then we also use another artist. We use kind of cultural imagery and cultural icons to get the message out there. Here you see the Virgen de Guadalupe, kind of very materialistic kind of image protecting the child. And you see the vaccines on one side. And then you have on the right, it's a kind of very masculine trope of a person who looks like Vicente Fernandez, a Mexican singer, and he's on a horse. He's got the vaccine in his hand. The vaccine is, shooting something out to the coronaviruses. So it's a very kind of masculine, very nationalist kind of appeal, again, to normalize the vaccine. So let me show you. I'm gonna start sharing for a second. Let me show you what these animations look like, and then we'll open it up for discussion. Okay, let me see if I can share screen. Okay, so I'm gonna start with this 30-second kind of the teaser, the trailer that we started.
For most of the last year, the coronavirus has shaped how we live our lives. We have been separated from our loved ones. We have lost work and livelihoods, and life has become much harder and separated. But there is hope. Vaccines have been developed to fight this virus. It is up to us now to make sure everyone from our community gets vaccinated. Will you be the hero we need? Help our community by participating in the vaccination effort. To learn more, go to covidlatino.org.
We launched the website. We Then we shifted, when we had the website, we shifted to social media because that's when data was coming out that most of the information exchange was through social media. And let me show you the evolution of these animations. So this is the first animation we did. Let me show you the Spanish one, and then I'll show you the English one. The Spanish, yeah. So let me show you the Spanish one, then I'll show you one of the Zapoteco ones.
Lo hacemos, dice. Así, así, como baila la colita. Si no
Don Francisco,
la mueve, la tiene papadita, vuelta.
me encanta esta canción, pero la colita se debe quedar en casa. ¿Por qué motivo? Por el coronavirus. Déjenles explico. El COVID-19 es un nuevo coronavirus, una familia de viruses que afectan el sistema respiratorio. El virus entra al cuerpo por los ojos, boca y nariz, y se extiende a los pulmones, y se multiplica rápidamente. El sistema inmune se activa para contrarrestar el virus. En la mayoría de los casos, el sistema inmune de las personas resiste y elimina el virus, y tendrán síntomas templados o incluso ningún síntoma. Pero personas de edad avanzada con condiciones médicas como diabetes, cáncer y problemas cardíacos son más propensas a enfermarse porque el virus causa daño a los pulmones. Algunas de las personas necesitarán un respirador artificial y algunas personas, desafortunadamente, fallecerán. Es por eso que debe evitar tocarse la cara con las manos.
O lávense las manos al tono de feliz cumpleaños. Feliz cumpleaños a ti. Y no sean como este muchacho que se la pasa visitando todo el mundo. Quédense en casa.
And this is the first animation we did. As you can see, the quality is not as good. I'll show you the latest ones. So we started, and the messaging was, what we first heard: stay 6 feet apart, social distancing, wash your hands, wear a mask. That was the messaging that we started with, because that was the messaging we had before the vaccine, and that's what we knew. And then as we, as the pandemic, evolved, we started getting more fine-tuned in our messaging. This one here is one that we did to address in the data that we collected. We saw that there is this fear of the government is trying to track me, or there's a chip in the vaccine. So we were trying to be mindful that those fears come from somewhere. They don't just come out of the air, thin air. There's a history with these communities and the way they interact with the governments and these institutions that builds this mistrust, or that creates this mistrust with the immigrant community. We've had a history of hostility against immigrants, where we're constantly trying to find ways as a society to kick them out, to kick people out, certain people out. With the Black African American community as well, we have a history of mistrust because of the way institutions have treated Black bodies. We have a history of slavery. We started with slavery. That's the reason we had Black bodies in the U.S. What is now the U.S. is for work, for labor. So there's this history, and it makes sense why people distrust the vaccine, why they fear that the government is not being truthful. So we got to understand the context, but yet we got to try to find ways to still not so much convince people, but show that the vaccines are helpful, the vaccines work, and try to break a little bit of that distrust. So this animation I'm about to show you, it gets at some of that.
They are going to chip you with the vaccine. They will follow you. They will track everything you do. Look, I'm so upset about this. My temperature is 102 degrees.
Oh, Tío Rigo, there are no chips in the vaccine. stop spreading false information on social media. If our community doesn't take the vaccine, then the virus will bounce from body to body, creating new mutations, which may become resistant to the vaccines. That's why everybody needs to take the vaccine. It trains your immune system to fight the virus. The vaccine contains something that looks like part of the virus, but is not the virus itself. Our bodies learn to recognize it and learn how to fight it. These help our body make something called antibodies that can attack and kill the real virus before it starts to spread. So make sure you go and get vaccinated.
Rigo, the doctor is right. Stop spreading nonsense. Nobody wants to track you. And if they did, you put everything on the internet already. Put that thing away and come have some frijolitos con nopales.
I'll show one more. I still got time. I'll show one more so you can see the Zapoteco one. So we made sure, here's a different one. In Zapoteco, so we know that in California, there's a growing indigenous Mexican immigrant community, Zapoteco and Mixteco being the largest ones. So we worked with a Zapoteco group, a family of actors who helped us translate the messaging. So I'll just show you what that sounds like. And this is a different animation.
Itenok son dageshana. Ni de kojigana son doctor san. We nesto de que wakye gano wish shigis zweli gishana. Vitosh kakasui.
Pabihush Rodriusha. Pito son de pargon Joshua, de que yesha coronavirus, jekwanan, ora obena wish. Yesha nakanjwale segur, lemenaka, jesawasha, nabenakas renwa, nabenatson shwab yesasovici, después can ora, cabibio. Nolkas renwa, sak change in coronavirus, chetan san de mal, parnabo, nabijenka. Tuja agenda subicia, na dena agenda suagesha de coronavirus. Na caga pa familia, cuidado.
Na poksa doktor Arsona leukia, pausuanda yeshe coronavirus na bitus chevagua.
PowerPoint. So we did some of those, we did those animations. We have more. I think we're gonna have 25 of them when the project is over. So what we did, you saw in some of you saw in the first one that I showed, if you're familiar with Don Francisco, which is a very popular talk show host, we used him in the opening scene, and we had J-Lo and Shakira from the Super Bowl in the closing scenes. So then in the second animation, the one where he's being chipped, we work with a lot of these themes that come up. One is social media is where this information is being spread. So we kind of portrayed it as he's had his own YouTube channel. He's one of those who believes in these different conspiracies, and he's spreading this misinformation. Then the doctor and the grandma come in and kind of talk with evidence of other things. So that's what we did with the animations, and again, they're designed to bring the same messages that's already out there, and using information from the data we collected to give it back to the community in ways that are easy to understand and somewhat entertaining. We use jokes, or we use comedy to some extent, because in the Latino community, we make fun of everything, right? We laugh at everything. So I'll end here. I'll just go through some of the art. This is the art that Lalo Alcaraz did. These are the cartoons that he did. And it talks on a lot of different things. You see here is the fear of the vaccines are dangerous. the message here is like, we're already doing behaviors that are more dangerous than a vaccine. And smoking, alcohol, driving, a lot of these things might put you at higher risk than getting COVID. The middle one here, when there's this fad that came out that says that a lot of people were waiting for Pfizer, the Pfizer vaccine, because that was the cool one. That was the bougie one that people wanted. So they were waiting on and holding off to get that one. So this cartoon kind of addresses that. The one on the right is the fertility, the belief that's going to cause infertility. Community, this issue of community. Don't be that one tío. Don't be that one uncle who doesn't get vaccinated. It's for everybody's protection. Again, we tend to live in intergenerational homes, so it's not like people could isolate whether or not they're protecting themselves, because you have other people in the household who put you at risk. So that's what the one on the left. Again, pregnancy of how effective is it? Does it harm the baby? The loteria one, which I talked about, the farm worker one. These are the two more popular ones. And then he continued working on, with the loteria trope, his lucha libre tropes of herd immunity, and how that helps you protect the rest of the community. And here, this is the last one he did. The one on the right is now that Delta's coming. We know Delta, it's higher transmission, and it could be deadly. It seems like it is deadlier. So you have the coronavirus saying, hey, check, here's my cousin Delta, don't mess with Delta. And this is kind of plays on the idea of everybody has that one cousin who comes visit during the summer, and he always, he's the tough guy. He comes from, from very tough neighborhoods or whatever. Everybody knows that one kid who has that cousin. So that's what it is here. Delta is that cousin. Don't mess with Delta. So I'll stop there and I'll field any questions. I can't see any chat. I don't know, Sean, if we have any questions, but I'll stop here.
Thanks so much, Dr. Lopez. We do have a couple questions. Also, just kind of a minor thing. So if you happen to be here for any kind of extra credit, I put a quick form into the chat that you can kind of click on, fill that out, and we'll send your instructor any kind of extra credit information. And if you do have any questions, again, be sure to add those into the chat. And I'll just go through some of the questions we have so far. So one of the questions was, what would be some strategies you see as effective for combating misinformation regarding COVID-19 in the Latinx community?
Well, I think the number one message I would give is have some sort of empathy for why a lot of this misinformation is coming through. Why is this so rampant in our community? And there's a lot of reasons. One is educational levels. So we sometimes take for granted what our educational system provides us, this critical thinking or awareness of verifying information. Well, a lot of the older folks, immigrant, they fled or they left, whatever country, whatever region they're coming from, because whatever system was in place, political and economic system, wasn't creating an environment for them to live. That means that they, on average, have lower formal literacy, reading levels, writing levels are lower, and also they didn't have this, kind of rigorous training that we go through in order to verify information and how to become more critical consumers of information. So that's one reason. It's that, and what I say is we gotta be mindful of that. We gotta be aware of that, and not vilify and not stigmatize it, but work within that framework. The other one is that I mentioned earlier is be aware of history. Be aware that a lot of these fears are not, again, they're not as wild as we might think. Just look at history. And we do have a history of certain populations, whether it's we trying to literally eradicate them. We saw that with the Native American community in the history of Native Americans. We actively try to eradicate these communities, the government. We enslaved these bodies, Black bodies. We literally saw them as property. And currently with the immigrant communities, the Latinx immigrant communities, we vilify them. They're the ones bringing the disease in. They're the disease people. So we need to make sure that we kick them out, that they don't come in. So there's a history of why these ideas and these perceptions emerge. And it's not enough to just make fun of it and say, no, you guys are off your rocker. You don't know what you're talking about. It's not enough. That doesn't help. So we got to understand that history, that context of where these ideas come from, and then try to work with those, try to work within those. So that's the number one takeaway that we're getting from this project is, be mindful of that, have some empathy for where people are coming from. Because at the end of the day, I think everybody wants to care for themselves. They want to care for their community. It's not that they don't care about it. It's just how they perceive this and the trust they have that it's a big factor. And we're trying to break that. And it's difficult. Someone asked about metrics. We are analyzing this data. We've reached over 2 million people with our campaign in 6 months. And then we just got a grant to continue doing some more of this work. So we hope to reach more people. The message keeps shifting now that more people are getting vaccinated, but still the issues are there. So I don't know if that helped answer the whole question, but those are my thoughts on that.
That's a good answer for sure. Another question here. So in addition to Latinx community, COVID has a disproportionate impact on a variety of other minority populations and rural communities throughout the U.S. What are some similarities you see with COVID's impact upon the Latinx community to these other communities? And do you see maybe similar solutions?
Yeah, and did they mention rural? Is that what you said?
Yeah, rural and kind of minority.
Yeah, no, thank you for bringing that up. So one of our analysis we're doing, I'm interested in rural health as well. There's kind of, with the Latinx community in rural America, there's a couple issues going on. One is we know that the pandemic disproportionately hit rural communities, regardless of racial, ethnic background. Rural communities were affected. We also know that the Latinx community, or let me rephrase this, rural America is having a decline in population, in white population, but rural America is having an increase in population of Latinx community. They make up 90% of any increase, any growth in population in rural America is the Latinx community and other immigrant communities. So there's sort of demographic shifts. So you have this kind of double disadvantage. One is just living in rural America, the pandemic's hitting you harder, but also being a racialized minority in America, the pandemic hits you harder. You put those together, and it's a recipe for disaster. We have minorities in rural communities who are being even more disproportionately affected than others. So that's what we found. Some of the data, I didn't show this, but some of the data we have is that the Latino community, the Latinx community in California and Arizona, California Central Valley and across Arizona, they are more concerned about getting affected than the non-rural, than the urban and suburban Latinos. However, they're less likely to say they're going to get the vaccine. So they're more worried or feel they're more at risk, but they're less likely to get the vaccine. So we're trying to see why is that disconnect? And that's our follow-up question that we have. Is it structural? Is it that they don't have access, to clinics? They don't have access to services, testing, or vaccines? Is it cultural? Beliefs about, what's in the vaccine? What's going to happen when I go get the vaccine? We're trying to understand what is it? Is it cultural or is it structural? And that's what we're trying to answer. But we do see that difference within the Latinx community by rural America. Broadly speaking, I think a lot of it has to do with the distrust again. Distrust with the white, poor, rural America and the shifting demographics and how they're being left behind. And we see this with the opioid pandemic as well, right? We see how it's disproportionately affecting rural poor white communities, and how there's been a neglect. Historically, there's been a neglect, and we saw this, through the Dust Bowl in Oklahoma, where you had large groups of rural poor white people moving out west. So there's a history with farm workers and farmers and the way they interact. That's not much different, or somewhat, well, maybe it is very different, but somewhat the same of the way these social structures affect different populations. And the same is with rural America. So that's what we've seen with our data.
Yeah, like one more question here for you. So, what is a recommendation you might have for someone looking to do their part to combat COVID in their community? I guess what might be something the average person can do to help?
So yeah, there's many things I think people could do. One is if you have access to information, share that information. For example, this campaign, everything we create, it's free to use. Everything here is accessible and available to everybody. I'll put in the chat. I'll put the link to the animations, so anybody here could share those. I'll put them here in a minute. So that's one. Is if you have access to information, don't take that for granted. I'm trying to see everyone here. Okay. So I'm putting the series of animations that I show, I'm putting them here, the English ones, and let me put the Spanish ones too. So share information that you have access to. Don't assume, again, this information is very simple. If you look at it, it's like, yeah, no, duh, this message, wash your hands, stay 6 feet apart. There's nothing in the vaccine. There's not chip. We take it for granted, but again, this information is not coming through to the community. So share information. The other one I said, we just got a grant to do more of this work. I'm inviting anybody here I'm a product of community college. I believe in community colleges. Anybody wants to get involved with my campaign, you're welcome to be part of this. And there's many different, we're doing research, we're creating more content, we're doing social media pushes. So if anybody here is interested, or anybody who sees this later on is interested, reach out to me. You're welcome to be part of this campaign. Again, I believe in community college, and I want to get community college involved in any research that I'm a part of, because again, I'm a product of the community colleges. So those are a couple ways. Get involved that way. Volunteer with drives to get people vaccinated. But I think number one is share information, share resources that you might have access to. Don't assume other people know about them.
Well, thanks so much, Dr. Lopez. This has been a fascinating lecture, fascinating topic, and excellent work you've been doing. So I guess we'll give you a virtual round of applause. Yeah, but yeah, thank you so much for coming. I think it's been a really fascinating lecture. I think it'll be really beneficial for our students, and I'll share some of those links too when I share out some of the videos and things like that as well. So yeah, so thanks again for your time, and thanks again for everyone who joined us today. Yeah, so that's pretty much it for all we have, and we definitely appreciate it. And got a couple of people saying thank you for the information and all that as well. So.
Thank you all, and again, reach out if I could be of any help throughout your careers, the community college, or if you want to be part of any of this research, or talk about future, transferring or whatnot. I'm a resource. Think of me as a resource. I'm here to help in any way I can. And thank you, Sean, for inviting me. It's been a privilege to be here.
All right, thanks so much, Gil. All right, take care, everybody. Have a
Yeah.
great rest of your day.